So today we're going to be talking about a conventional psychotic called chlorpromazine. Some therapeutic uses for this is that it suppresses symptoms of schizophrenia. It also can treat acute manic phases of bipolar disorder and also relieve nausea and vomiting. It can also help with irretractable hiccups. Some adverse drug reactions that can be a result of taking this medication is Parkinson-like symptoms that may occur within that first month of therapy. Some dry mouth can also occur when taking this, along with constipation, urinary retention, blurred vision, and even fast breathing. You can also have a suppressed sexual drive or erectile dysfunction. You may also experience dermatitis, photosensitivity when exposed to sunlight, a high fever, some rigidness, loss of consciousness. Some interventions to be used when taking this medication is if a reaction happens to treat with a beta blocker or a benzodiazepine. You can also possibly switch to a low-potency antipsychotic. When taking this medication, you want to treat on a short-term basis with an anti-Parkinson drug. And then you want to monitor for these irreversible symptoms when taking this drug. And if anything happens, switch the client to an atypical antipsychotic. While the client is taking this medication, you want to monitor for dry mouth, constipation, and urinary retention. You want to also counsel your client about sexual dysfunction, because this might cause them to be very upset. If anything like this happens, change them to a different antipsychotic. You'll want to also monitor for vital signs, periodic EKGs, and serum potassium levels. You want to wear gloves when handling anything like this medication, and then use cooling measures and even antipyretics. You really want to make sure that you keep that client hydrated with lots of fluids. And then if they're having an anxiety reaction, you want to give them a benzodiazepine. When giving this medication, you want to give it with an oral dose with food and or a full glass of water to prevent any type of gastrointestinal upsets, such as constipation. Have the client swallow the sustained release form whole, so make sure they take that whole thing whole. You can also give an IM injection in a large muscle, but make sure you rotate the sites. You want to keep the client in a lying down position for 30 minutes after giving them either an IM injection or an IV dose due to the potassium low blood pressure. And you want to monitor, though, if you are giving an IV form to make sure that it's compatible with any other solution that you might be giving, or if you're giving other multiple drugs. And then for the client instruction, you want to notify the provider for feeling any type of inner restlessness or inability to sit still. You want to make sure to tell the client to notify their provider if the muscles feel really rigid, if they're having any type of tremors, any sluggish movements, drooling, or a shuffling gait that can happen. You want to make sure that the client knows to notify the provider for severe spasms of the neck and body. You want to also instruct the client to notify providers if any type of involuntary movements of the tongue, face, limbs, or trunk begin to occur. They can try to chew gum or suck hard candy to treat dry mouth, and they want to increase their fluids and fiber intake to prevent constipation. They also want to urinate just before taking a drug dose, so encourage the client to report any types of these symptoms. They should especially report any types of heart palpitations, fainting spells, or other type of cardiac symptoms. Make sure you instruct your client to wear gloves when handling any type of their medication, and instruct the client to avoid sun exposure, use sunscreen, wear protective clothing, and sunglasses. And you also want to make sure that if they have any type of sudden fever, to immediately report this to the provider. Some contraindication that's going to happen is with alcohol withdrawal, they can have a bad reaction along with bone marrow suppression, or any type of central nervous system dysfunction can also cause bad reactions. And also, you especially want to avoid this when and if you are possibly pregnant or think you might be pregnant. because this can cause a really, really bad reaction and can potentially hurt the baby, and if you're lactating. Some precautions that you want to take are you want to monitor for respiratory disease, so if they're having any type of breathing issues, any type of glaucoma, if they have diabetes mellitus, or if they have high blood pressure. You want to monitor for anything like that. Or if they have any type of thyroid, cardiac, or liver disorders. Interactions you want to watch out for is central nervous system depressants and increasing sedation. If they're taking any type of antacid or antidiarrheals, you want to space them out between 2 hours from the Chlorpromazine administration and due to poor absorption. And then lastly, if they're having any type of decreased blood level of anti-seizure drugs, you want to really watch for anything like that. So in the end, this drug is used a lot in the hospital, but you really want to make sure that you know what you're talking about and what you're doing when you're giving this medication, as it can have many types of interactions, adverse effects, and it's contraindicated. Thank you.